Healthcare workers who are usually in the front line in the fight against COVID-19 risk a lot as they fight the pandemic. But just what goes on inside the mind of health workers who attend to COVID-19 patients? Our reporter Gabriel Kudaka visited Kamalel Isolation Center in Uasin Gishu County and brings you the details.
Wilson
Lagat touches base with his family, however not in person. This all-important call is a necessary update for Lagat, who is a nurse and has been at the Kamalel Isolation Center for the last 10 days since one of the patients tested positive for COVID-19. The pandemic has dealt a blow to many, even those who have not interacted with it firsthand. But for healthcare providers attending to suspected cases of COVID-19, the experience is an even more concrete reality.
Kama mimi mwenyewe nilikuwa na uoga sana. Manake ukiangalia katika runinga ama ukipata ripoti za dunia na kuona watu jinsi wanakufa, unajipata katika ile hali na unapata uoga. Being family, all of us have families back at home. This is a challenge because you have to be away from them. You have to communicate through the phone. We don't need to move out of the gate unless we use the ambulance. The county government of Uasin Gishu has organized in that counselors do come in to counsel the patient and counsel the staff.
Even when we got our first case, kulikuwa na hiyo panic. Some people could say sikuji leo nimeenda kuona mtoto. Mmoja anasema sijisikii vizuri. Wengine mnaenda mkifika gate anabaki nje. After experience of seeing the first, the second client, you get to see us this like any other patient. As long as I take precautions well, COVID is like any other disease. We might create fear in COVID. But we had other diseases like Ebola, which were more dangerous even than COVID. We may have other diseases which will come.
Sasa nilipata simu juzi kutoka kwa boda ya Uganda. Akanielezea ni sample yangu imeonekana niko na positive. Mimi naweza waambia siogope kabisa kuenda kwa isolation kwa sababu hakuna kuogopa hapa, hakuna kitu mbaya kinafanyika.
These healthcare workers here say getting in touch with the family members alongside frequent counseling helps them to cope with the situation.
People out there in town don't really want to move closer to the ambulance. It is referred to as a corona vehicle.
The mental health support is key for healthcare workers as the stigma within the community is a tangible problem. And for these who are here, it is a much needed relief as they are away from their families and can only engage them virtually at best, at least for now.
One thing that keeps us going is the encouragement that we get and the prayers. When you sleep, pray. See yourself as a soldier.
Gabriel Kudaka, NTV.